Have you heard of an IUP test? Hi, this is Dr. Chang. So this is a secret urine test that I'm going to show you and share it with you in this video. In fact, this test is so special that most doctors are not familiar with this. You probably heard of blood tests or urine dip tests that you typically do in clinics or hospital. Those are what we call damage assessment tests, meaning they only tell you what's already broken. But this special test, the secret test I'm going to tell you in a minute, tell you what's breaking. So what's going on in real time in your health, how your digestive system, your immune system, and everything else is working in synchrony to keep things in balance. Okay, so go ahead and stay tuned, and I'll show you exactly how this test works. So here's a copy of the report. It's a very colorful looking report. So there are mainly two parts to the report. The first part is called the pathology screening section. So this will tell you basically what's broken. This is a typical analysis you'll get from a urine dip test. Like it will tell you about your glucose, protein, bilirubin levels. So again, this will tell you what's already broken. But the problem is we're not dealing with most of this problem. And this is probably about 5-10% of our clients or patients that applies to this category. But what we're concerned about is the bottom one. It's called the graph of pattern. This is where like 90% of the patients or the clients fall into this category, okay? So let me go over this real quick. There are 8 parts to it, okay? 8 parts. I don't have enough fingers to count that. But anyway, the first one is called indican. So indican tell you how well your digestive system working. You probably have a leaky gut syndrome, right? The major problem that we're encountering right now, especially with the obesity and overweight problem, it has to do with digestive stress, okay? Digestive problem. So we need to find out whether you're struggling with digestion or not. So this will tell you, the indicator will tell you that. The next column is the sediment, which tell you once you digest or break down the food, how well your body can absorb those nutrients. We're talking about macronutrients like carbohydrates, fat, and protein, because that's important, because if you're not absorbing the nutrients, you're gonna struggle. I mean, you're gonna feel tired, you're just not gonna feel good. And for example, like if you are trying to go on for example, like a keto diet, which is like 75% high fat diet, but what if your body cannot digest fat? Okay, then you're gonna have have a hard time and problem with that. So this part will show you what you can observe or not. The next one will show you your calcium level, which is again very important to know because it'll tell you about your bone density, vitamin D level, which is again important to know because vitamin D is antibacterial. So if you're low in vitamin D, it's going to compromise your immune system. And the pH level will show you how, again, how well your digestive system working, whether you're going into acidic or alkaline level. And chloride, okay, the chloride will tell you whether you are eating too much processed food and salt. And if you have an elevated chloride, for example, that's going to put stress on your lung, which is not good, okay, right? Because we need to have a strong lungs, especially in fight against COVID-19. Next one tell you your volume to see whether you're drinking too much water or too little water, and whether you're going into a chronic dehydrated state. And then the next column was specific gravity. This will tell you how well your kidney is working, how well is filtering the waste metabolic products from your body. Okay, so that's very important to know. And then the bottom here tell you color. So color of urine will tell you, for example, if it's white, it tells you have a lot of yeast or bacteria or candida growing in your system, which is not good because you have all these foreign materials or the things that are going on in your body that's toxic to your body. So that's taxing your immune system, right? So that's not good. We need to get rid of those. And the bottom here is the vitamin C. Vitamin C, again, very important because vitamin C is pretty much a very important factor in terms of our immune system. So if it's deficient, obviously we need to improve that. But problem is, even if you're taking all the vitamin C supplements, taking a truckload of it, but if your body cannot absorb it, you're pretty much wasting it, okay? And the problem is, if you cannot digest carbohydrate, for example, your vitamin C absorption is going to be low because vitamin C is 5 carbon sugar, right? So that's why you need to check to see if your vitamin C is low or high. And lastly, it's an NPN, which tells you whether your body is going to catabolic or metabolic state. So this is really, really cool test, give you like a full story of what's going on in your body right now, the real time. Okay, this is not something that's broken, but this breaking. So it's telling you, it's like a sounding alarm. Hey, get out of track, train is coming. So we need this test to basically help with our weight loss patient to find out where the problems are. So we use the science. We use this very specialized test. In fact, this test, you cannot even find it at hospital or clinic because it's, like I said, a very specialized test, very complex, time consuming. In fact, there's only 2 laboratories in the entire country that can actually run this test. And luckily we were able to find this laboratory and can be able to use it and process the report. So anyway, if you're interested in this specialized test, please call our office. And also we are now offering a very special offer for this test. So if you want interested, go ahead and call us and let us know. And finally, if you're also interested in our weight loss program, Doctor Supervised Weight Loss Program, go ahead and click on the link above. You can sign up for a free online consultation with me. All right. So I hope this was helpful to you, and please go ahead and share this information with people that you know who wants to lose weight and boost your immune system and know where they are. This would be a good marker to show you where you are in terms of your health and overall well-being. All right. So hope you have a great rest of the day and take care. Bye-bye.